Well, Elina, I'm happy to have you on Coffee with the Founder today. It's later in the day. I don't think we're having any coffee, and that is okay. Unless you do. Elina, do you have some
No,
right here?
I'm going to
Okay.
be partaking of flavored water. So,
Awesome. I got a Gatorade, so we're going to do it with that. Elina Onitskansky, you are from Ilant Health. You're the CEO. You're solving quite a number of things in the value-based healthcare space, difficult as it relates to obesity and cardiometabolic conditions. Been a little topical in the news cycle as of the last, year and a half or so. So let's just start with, how's it going?
It's going really well. I think when I started the company, GLPs were not a headline issue in many cases. Obesity and cardiometabolic health weren't actually headline issues, not even in the public press, but frankly among health plans and employers. And I think that has obviously changed a lot in the last couple of years. But, I think we still see real gaps in the care that's provided and the experience individuals have. And so it's certainly an exciting time to be in this space and be on the forefront of transforming metabolic health, which I think is frankly the moonshot of our generation. And we feel like there's interest, but still a lot of work that needs to get done.
Elina, you were mentioning just now on this is encompassing of metabolic health, which sounds like, what is that? Is that working out, making sure all my calories are being burned, I don't get diseases? How do you encompass what that all entails? Because that's a big thing. And specifically, right there on your website, you talk about value-based obesity management. And that's a whole other realm for us to get into of what is value-based. So first, let's tackle metabolic health and what that encompasses.
Yeah, so maybe to add to the buzzwords here,
yes,
I actually think about metabolic health as the core to longevity, right? And not longevity in the popular way it's become, which is like, what vitamin D infusion are you taking today? But longevity in the sense that we want to live long, right, lives where we feel good going about sort of our daily tasks, right? So actually, by the way, when we think about a lot of folks with us, right, it's really about how do I, have a long life where I get to enjoy my family, my grandkids, hiking, whatever it is that you enjoy doing. And so to me, metabolic health is sort of the core of that. So if we unpack that, it is about, frankly, preventing, or in some cases, supporting remission or reversion of chronic diseases, right? And so that may include diabetes, it may include cardiovascular disease, but really what we're trying to avoid is these chronic conditions that shorten your life and sort of shorten the quality of life, right?
Yeah.
So that is like ultimately the goal of metabolic health. And the way we tackle it is through obesity. And the reason we think about obesity as the core to tackling metabolic health is it is both causal and comorbid with a number of other conditions that decrease your health span and your quality of life, right? So obesity is causal and comorbid with diabetes. It obviously, can impact sort of musculoskeletal pain. It certainly can cause heart conditions, right? As well as obstructive sleep apnea. It's comorbid with a number of other factors. And so we really think about obesity treatment as sort of the core to driving metabolic health improvement at an individual and a population level. And so, to us, that's also around when you think about obesity treatment, I think a lot of the popular press views it in the lens of weight reduction, right?
Yes.
And that can very easily veer into appearance, right? And look, I would say people can be motivated about their appearances, right? There is a reality in life that people perceive us the way we show up, right? And so I'm not discounting sort of that appearance matters. But when we think about health, right, when we think about obesity treatment as a health-focused treatment, it's not about appearance. It's actually about sort of a reduction and reversion in many of these conditions, many of which are some of the most costly conditions that we face as individuals, as companies and organizations, and as a country.
Ooh, okay. Now let's get into what you're even more specifically, Canley, which is you're saying value-based obesity management and cardiometabolic health. So this is, I'm assuming you're selling to companies, employers to be like, hey, we got to have your employees being healthy and so forth. So how does that value-based management look?
Yeah, so it really looks around using obesity care as a lever to frankly reduce broader healthcare costs as well as improve other metrics. So, what it really focuses on is, hey, can we actually reduce your diabetes costs, your cardiovascular costs? Can we actually support your occupational health goals, right? By addressing musculoskeletal pain or obstructive sleep apnea? Can we help improve productivity, reduce absenteeism? Like, it's
Yeah,
all of
all
those
the things.
pieces built
Yes.
together. But the foundational one is this idea of really using this care to address that broader set of chronic conditions, right? That are incredibly expensive, right? And I would say what's also really important and comes part and parcel of that is recognizing that that appearance changes may be an outcome of this good medical care, but they cannot be a goal in and of themselves.
So let me ask you this, because I feel this is for any employer who's going through oh, how do I make my employees, healthier and so forth? How do you tee this up to employees? Is it, this is an offering that we have, here you go, everyone is accessible to this? Because of course, HR 101 is you can't go to one person and specifically be like, hey, Dan, you should look into this because I physically see that you look obese. I mean, that's just not going to work.
Yeah, so look, I would say a really core part of our model, and I think core to what makes us successful, is not being judgmental and sort of trying to meet people where they are.
Yeah.
And so I think part of that is, you don't want to go to someone and say like, hey, I think you should do this. I think you should do this, not me. I'm perfect, so I don't need to do it, but you should definitely do it. But I think we want to do, we do, when we work with employers, we do broad-based communication so people are aware of it, but we really focus on tone and style. And I would say we really believe that we bridge technical and the human. So a lot of what we've built on the back end is deeply scientific, right? We have data-driven models that really focus on who are the people that are highest value to engage and what is the right treatment for them, right? And we're looking for the most evidence-based, most clinically robust model. And then that only works if when you have a human in front of you, right?
Yeah.
You can modify that for that person who lives in the real world and has kids that don't want to eat X and has a job that makes them travel Y days a week, right? And so it's really bridging those two pieces. And so I think the reality is, in today's world, many employees are excited. They're also seeing all the headlines we're seeing, right? So GLPs are out there. They're seeing hey, this could work for me. So there's a lot of excitement on this. But I think, as we've also seen, real world outcomes have not been great. And we're increasingly seeing among our members that folks are sort of saying, hey, for some people, look, it does work great with no support. But for the vast majority of people, it's not yielded the outcomes they maybe fully wanted to see. And so they are looking to understand, how can you help me? Right. And so I think bridging those two pieces, the deeply technical with the deeply human, I think is really core to success here.
It's always the human piece that needs to be incorporated, Elina, typically. Are you having fun?
I would say if you talk to any founder, if they tell you they have fun every minute of the day, I would say they're maybe not being super authentic.
They're not.
Every day, every week is an up and down, but ultimately, I get to work with really innovative clients. I get to support individuals who are looking to change their lives. I get to, hear about transformative moments, people who ran their first 10K, their first half marathon, people who got to sort of take a trip they never imagined doing, play with their grandkids on the floor. Those are incredible moments.
Yeah. Those are redeeming moments, I'm sure, too, of all this work that I'm doing and what am I doing it for and so forth. One question I haven't asked recently, and it is one that I do enjoy hearing from founders, is what's your favorite emotion and why?
I actually think it might be anticipation. It's like, I feel like
Ooh,
anticipation is that combo of excitement and anxiety.
yes.
So you're like excited for something and you're
You're
like
like,
not
yeah,
100. So I feel like anticipation is a really like, it's a core emotion as a founder, and it's a really fun emotion because it's sort of like you're not quite there yet. You're
not quite
excited.
that.
You're a little, yeah. And so
Yep. Yep.
anticipation.
Yes. Ooh, okay. I haven't had anticipation in quite some time. So thank you for sharing that. How are you doing on the talent side? Because every founder I'm talking to right now seems to be like, oh yeah, dang, like how do we get the right talent here? And not a slog, but it is ever more important and pressing on how you get the right people into your startup. Not because you want to do crazy things like in 2021 of like, let me overpay you, 400K extra. But no, we're not in that realm of things, but just talent remains on the forefront, it seems.
So I would say I think about hiring and talent in some sense the same way I think about sales, and in some ways the same way I think about fundraising, which is
Mm.
like you're looking for the right match.
Yeah. Yeah.
And so, I would say I feel really good about where we've landed, but part of it is like my view that you want to actually spend time in that process, making sure like, are these folks that both bring the capabilities you need, but are they really bought into what you're like the culture, what
Yeah.
you're trying to do, right? The goals. And so I think there's often this conversation of like missionaries and mercenaries. And I think you need, frankly, folks that are both, right?
Hmm.
And so I found that like, I think we feel really good about talent, and I think have gotten excited when people come in and they have, obviously you want to create a compelling value proposition for folks to join on that, missionary side, but you
Hmm.
also, or sorry, on the mercenary side.
Hmm.
But on the missionary side, really want alignment around sort of, how we think about the world and, how we think about creating value. And I think there's something really powerful around like that, at least the way I sort of think about where you want to land in those places.
Hmm. Hmm. Mm. Going to the start of this company, speaking of bringing on people who have the mission clear and are aligned with you, what made you start this? Because as I said, you're 4+ years in. You were a senior advisor previously with the capital team. You've been strategic advisor. You've been doing a lot of things in the health tech space for quite some time. What made you go, you know what? It's time to start this venture-backed, fan-dangled thing here. My God.
So I joke this started like all good HBS case studies. I was sitting at the
You were a research
ocean, looking
assistant.
off
Also, yeah.
into the
Oh,
distance.
yeah.
You're always looking into the distance in
Yeah.
every HBS case study I've seen. No
Yeah.
one's like at their desk looking
Grinding
down,
away. Mm,
working.
yeah.
No case study I've seen. So I
Mm,
was sort of, at the beach looking off into the distance. And I had a very big aha moment coming off of my personal journey with obesity. So,
yeah.
about a year and a half earlier, 2 years earlier, I had gotten treatment for myself. And that was
Mm,
the moment where I was like, holy moly, like, not only did I lose the weight, which I had done sort of multiple times before in my life, but I actually retained that weight reduction.
oh,
And I had this moment of
so it
like, oh
stuck.
my gosh,
Yeah.
like I've seen this movie before.
Yeah.
Like it's mental health, it's, maternal health, women's health, all of these
Mhm.
areas that had gotten fundamentally misunderstood. And basically said, gosh, like this is the area that like really needs to transform right now. And sort of went out and said like, look, is there a company doing what I think should be done? And I didn't see one. And so set out to build
You're
it.
like, we're gonna start that. Yep. Hmm. What about what you've changed your mind on recently, given all the changes that have happened, of course, in this space and thinking about obesity and the GLPs and whatnot? Maybe it's not related to that at all.
Yeah, so it's interesting. I am a scientist by training. So my
Mhm.
undergrad was in chemistry and physics, and I actually spent a lot of my time in sort of quantum dots and that area. And so a lot of
Fun.
time spent in a clean room in a non-fun bunny suit.
Yep.
Um, before I realized that
A
extroverts
non-fun
really
bunny suit. Yes.
Before I realized that extroverts really shouldn't be put in clean rooms for an extended period of time.
Yeah.
But like, I'm a really big believer in sort of scientific method, hypothesis led, or said another way, like holding strong beliefs lightly. And so look, in some sense, I don't know that I can name something I changed my mind on in last month or 2 months, but like what I know with complete certainty is, you know, we follow the best evidence-based care there is today at Ilant. And I know that in 2 years, it will not be the best evidence-based care because the field will evolve, we'll learn. You know, we actually are learning a lot as we work with members on what drives motivation and adherence and how can we support people better. And so, look, I actually view that as, in some sense, the exciting part of certainly being in an area like this, which was just recently come to the forefront, which is like, we have the opportunity to do better, right? If not every day, then every week and every month, and sort of year on year, we should be seeing the way that we help people improve. And so like, I look forward to being proven wrong on some elements of what we do and, you know, doing better.
Does that, as to wrap us up just for today, Elina, does that weigh on you, the pace of the iterations and change that are happening as it looks not only in healthcare, but frankly, in the world of AI?
You know, I think it's hard to keep track of everything, right? And I think particularly when you think about AI, it's incumbent on leaders to actually be like in it, right? So like, it's not, I think unlike a lot of leadership historically, where you could say like, oh, here's my team doing X. I think it's really important to sort of have hands on in many cases and be sort of, you know, to use an overused term, vibe coding yourself and sort of understanding how things work, because it's one of those areas where to lead, you need to have real experience. So I think certainly sometimes like the time commitment to sort of do that on top of everything else can feel overwhelming. But I think it's also the exciting part. Like I think both when I think about metabolic health and obesity treatment, and frankly, the potential of AI, like we have the ability to do much better for our members and our customers over time. And so like, that's incredible. Now, if someone could give me a 25th and 26th hour in the day to like do some of that experimentation, I would totally take it. But
I'm with you
I
on
think
that, Elina.
the opportunity is incredible.
What a time to be alive, as I say in our agency, and to any founder I'm talking to, because seriously, what a time to be alive. It's arguably the biggest invention since the internet, if not everything else. So my God. Elina, thank you for being on here. You are the founder and the CEO of Ilant Health and making obesity treatment / accessibility for metabolic care more feasible when you work at a place. Needed. Thank you. Appreciate you.
Thank you.